So now we have already discussed what is mean by mentally challenged patient. So as a continuation of that, now we already know who are mentally challenged patient, right? So now we will discuss what are the special care we have to give them in order to fulfill their needs. What are the special care we have to give them? One by one we will see step by step. First one is, in the first step, what we have to do is forming a one-to-one relationship with the client, which means before starting the history taking or before starting the treatment, what we have to do is forming a one-to-one relationship with the client. That means we have to build up a good relationship with them, with the client, with the mentally challenged client. So how we will build up a relationship with them means we have to introduce ourselves to them. And that means my name is so and so, I'm your nurse, or uh, I will take care of you, like that. You have to give a brief introduction about yourself, and then after that you have to make him comfortable during that conversation, and then we can ask their name and all. We have to let them introduce themselves in front of us. Okay, by doing that we can build up a good relationship with them. So first of all we have to do is building a good relationship with them, with the client or with the patient. Okay, and then next one is constructive feedback. So after building up the relationship, after that introductory phase, what we have to do is we have to ask feedback from them, like how do you feel after meeting me, or how do means do you like this conversation or not, or do you like to continue this conversation or not. So whatever he feels, he or she feels about the uh, relationship or about the conversation with us, whether he or she likes or not, we should get feedback from them. So which is very important. Why? Because if they doesn't have any interest, or they don't want to talk with us, they don't want to keep further relationship with us, then we should not force them. Okay, so mentally challenged patients are very important, means they are, we have to handle them with lots of love and affection, with lots of care. Why? Because their mental ability, thinking ability is already disturbed, right? So they will not be able to think normally. That is why we have to handle them with lots of care and affection. So here we have to get the feedback from them after building up the relationship. Then next one is trust. So after getting the feedback, we have to earn their trust. We have to create trustworthiness. Okay, how we will create means we should not tell lies unnecessary to them. Okay, as much as possible we should be honest. And then uh, if we, for example, uh, if you fix a meeting with that particular person or particular patient on a particular time, then due to any problem or due to any work schedule, if you have any work at that time and you are unable to meet the patient at that particular planned time, then what you have to do means you have to go directly to the patient and you have to convince the client uh, about your problems. Like I we already plan on this timing for our meeting, but because of due to some work or due to some problem, I will not be able to meet you at this time. So let us meet in another time. Like that, you have to go directly and you have to convince them for the next meeting. Means you have to postpone the meeting. Okay, by going directly to, by talking with them directly. You should not send someone to postpone that meeting. Okay, so if you do like that, then they will also gain their trust, or their trustworthiness will develop more and more. And if you don't do like that, means when you already fix a timing for meeting with them, and you without informing them, you are not going there, you are not attending the meeting, then their trust will be break, right? So in order to prevent that, you should, if you have any work or if you want to postpone that particular meeting, then you should go directly and you should postpone. Okay. And next is emphasize positive results. So as much as possible, you have to tell all the positive things to them. Okay. You should not focus on negative results, negative consequences, which you should focus only on positive results, positive consequences, like you'll be fine after a few months, or um, after taking this treatment or something like that. You have to give them positive hope. Okay. And then assessment. After that, what you have to do is you have to see, you have to observe them very closely, so that you can identify their changes. So how they were at the time of admission, and also how they are after giving treatment or after staying 2 3 weeks in the hospital. So behavior, their attitude, their nature, their body language, their expression, everything you have to observe while doing conversation with them. Okay, that is known as assessment. Okay. So if we do this assessment, we will be able to know whether the patient is improving, having progress or not. Okay. So you have to do assessment also, this is also very important. And then environment, and also we have to keep their environment very safe and comfortable. Okay. So we should not uh, we should not provide them a very loud environment, or very noisy environment. It should be a calm and comfortable environment, and also a safety and yeah, uh, comfortable environment to them. Okay. Environment is also very important to them, because uh, there are so many environmental factors which can trigger their mental status. So their mental status is already disturbed, and if you are not providing proper good environment, then their condition will be more worse. So we have to provide safe and comfortable environment to the mentally challenged patients. And then safety, also we have to provide proper safety to the patient. We have to give privacy to the patient. Whatever they are sharing you, uh, they are sharing you because they trust you. That's why, that is the reason what we have to um, keep their information, whatever they are sharing, their everything, whatever they share to you, you have to keep it confidential. You should not share to anyone. Okay. So you have to maintain the privacy, as well as you have to give safe uh, safety environment to the patient. Okay. And then physical needs, and also sometimes they may need physical assistance when they are um, going for toileting, or when they are doing their grooming things, bathing, or combing their hair, dressing up. So while doing all those daily living activities, they may need you. Okay. So all those also you have to assess, you have to check whether they can able to get up from the bed alone, or they can walk alone, or else they can go to the washroom or toilet alone, they can do bath alone. All those things you have to see, and if they need any help, you have to assist them. Okay. And then treatment planning, and treatment planning also, you should not start the treatment without asking their permission. Okay. So You have to explain the treatment planning to the patient first. After that, we should ask them whether they agreed or not. If they don't agree, then you should not start forcefully. Okay, so if they are not agreeing also, you should try to convince them with love and care. Okay, so you have to ask the treatment planning decision also from the patient. And then medications also sometimes mentally challenged patients are um, they don't take the medicines. Okay, secretly they used to throw whatever we are giving, or whatever medicine we are providing to them. Secretly they used to throw sometimes. So we have to observe them very closely whether they are taking the medicine or not. Okay. And then education, health education, not only health education, education regarding their uh, disease condition, the treatment modalities of the disease condition. And then uh, psychological support, related to psychological support, everything we have to give education to the patient as well as to the family members who are going to take care for the patient. Okay. And then discharge planning, next one is discharge planning. So before discharging, um, we should explain all the needs, what are the needs and what are the likes and dislikes, everything, whatever uh, information means we got from the patient while doing conversation with the patient. So all those needs and likes and dislikes, everything we have to explain to the caretakers, that is family members of the patient, so that they can take care of the patient properly when the patient is at home. So in discharge planning we have to explain everything about the uh, care needs, then medications, follow up, health checkup, all those things we have to explain very properly to the uh, client as well as to the family members especially. Okay, so this is about the um, special needs of mentally challenged patient.